leukocytes. So we're going to talk about white blood cells. So leukocytes are the least abundant formed element. Okay, so there's less of them than platelets or red blood cells. So typically we say they are between 5,000 and 10,000 white blood cells per, this should say microliter. That's wrong. Per microliter. Okay, so a microliter is a drop again. So, so there's less of them. And that can be a pretty broad range, right? So the function of white blood cells is to protect against infectious microorganisms and other pathogens. Okay, so they're a component of our immune system. Okay, the nucleus in white blood cells is going to be very obvious, and the cells are, sometimes they're bigger than red blood cells. Now what's cool about them is that they're not always in your blood, okay? So they can leave the bloodstream and they migrate to tissue, to connective tissue. They keep their organelles, okay, so they can go through protein synthesis, and they have granules in them. So all white blood cells have lysosomes, which they're nonspecific granules, so azurophilic. So they look clear, but there is a specific type of white blood cell called granulocytes that they don't look clear. You can really see them, obviously, when you have a stained slide. Okay, now the types of these, and we'll look at them in lab too. Okay, so the different types. So there's granulocytes and agranulocytes. Okay, and I always say Ben and Phil, okay, because they're Phils on the end of their name. Love Granny. Okay, so Ben and Phil love Granny. So the granny is to say, okay, they're grainy. Okay, now we have neutrophils, eosinophils, and basophils. And we'll look at pictures of them and kind of show you what they look like. Plus, you're going to look at pictures of them in lab. Okay, neutrophils, you can hardly see the cytoplasm, the granules in there. The nucleus, it has 3 to 5 lobes, so they call them polymorphonuclear leukocytes, or PMNs sometimes. Okay, so 60 to 70% of the leukocytes should be neutrophils. Okay, eosinophils, to me, they look orange in the background, so I always remember eosinophil, so it has an O for orange. Their nucleus is bilobed, so it has 2 lobes. And then basophils, the granules are real dark violet, and it's hard to see the nucleus because there's so much. So basophils end up looking really dark. Okay, and they're listed here in order. Okay, from like most prevalent to least prevalent. Okay, now agranulocytes, you can't see the grains. They don't look grainy at all. And there's 2 types of those. So there's lymphocytes and monocytes. Lymphocytes are about the same size as a red blood cell. The nucleus almost fills them up. They're kind of easy to tell. And then monocytes are huge. Okay, so monocytes are the biggest one, and they usually have like a horseshoe-shaped or kidney-shaped nucleus in them. Now we give you this trick: never let monkeys eat bananas, to remember the order of prevalence. So this is the order of prevalence. Okay, so never is neutrophils, lymphocytes, monocytes, eosinophils, basophils. Okay, so this is greatest to the least. Okay, now I have them listed out the function. Okay, so this is a really basic function. Okay, so neutrophils, they go up when you have a bacterial infection. So here's a picture of what they look like. Okay, so they're just kind of purpley, but you can see the nucleus, how it's got many lobes. They can phagocytize bacteria, and they release antimicrobial chemicals. Okay, so things that can take out microorganisms. Okay, eosinophils. Okay, so this is kind of, the background kind of looks orangey, pinkish orange. Okay, they go up if you have a parasite, some collagen diseases, allergies, okay, diseases of the spleen and central nervous system. Okay, they release enzymes to destroy big parasites. So if you had a worm, these cells would actually surround the worm and release enzymes to break down the worm. They can also phagocytize, so in endocytosis, they can take out pathogens. Okay, now basophils are different. Okay, so no, they don't go through phagocytosis. So no, they don't phagocytize. Everything else does. But basophils, what they actually do is they secrete histamine and they secrete heparin. Okay, histamine, what it does, and I think we've talked about it someplace else. Histamine is a vasodilator. So blood vessels are going to get bigger. Okay, and it makes capillaries leaky. So it increases capillary permeability. So if you think about when you are having an allergic reaction to something and you have a lot of histamine being released and your nose runs and your eyes run, okay, there's just all this fluid and it's coming from your capillaries. This will actually increase the blood flow to an area where there might be an infection. I'm sorry, this is on top of there. Okay, now heparin, some of you probably heard of that. Heparin is an anticoagulant. Okay, so what it does is it keeps your blood from clotting. So if you have an injury, okay, so say this is your skin and you get a cut, okay, and so the cut's going down in here, okay, and the pathogen gets in here. What will happen is your body will, it wants to get your blood cells to the cut, okay, so the heparin and the histamine are going to help increase blood flow to the area where the wound is. I hope that makes sense. Okay, now agranulocytes. Okay, so the first one I have is lymphocytes. There's two different kinds of them, and we'll talk about them when we talk about immune systems. So there's T cells, so there's helper T. Well, let's just put T cells and B cells. Okay, so T cells are the ones that coordinate your immune system, and B cells actually make antibodies. Okay, so just for right now, no, they coordinate immune cell activity. They can attack pathogens and go through phagocytosis. Okay, they can take them out, they can kill them. And they're responsible for producing antibodies. So those are lymphocytes. Okay, now monocytes, they actually can leave the bloodstream. And when they leave the bloodstream, we change their name. Okay, then we call them macrophages. So, and you can look at this word phage, and you can think about phagocytosis or phagocytosis. Okay, so these big cells can engulf something. Okay, so here it is. Okay, and they can engulf it, right? Go through endocytosis and destroy it. Okay, they're really big. We have slides that you'll learn from in lab. Okay, now leukocyte life cycle. So the production of white blood cells is called leukopoiesis. They arise from the pluripotent stem cells. Okay, there's three different things. So lymphoblasts can give rise to lymphocytes. Monoblasts give rise to monocytes. And then myeloblasts, they form the other three. Okay, now T lymphocytes are called T lymphocytes because their development actually finishes in the thymus. Okay, most of the cells are made in the red bone marrow. Okay, so red bone marrow stores and releases granulocytes and monocytes. Okay, lymphocytes, their development finishes in the thymus. Okay, now most white blood cells don't stay in the bloodstream. So most of them are found in the tissue. So they can be found in your lungs, they can be found in your intestines, they can be found in your around your brain even, especially the lymphatic tissue. they're found there. Okay, now they enter the blood, so they leave the blood vessels, and the way they leave is called diapedesis. Okay, so I think I have put a picture in here so you could see it. So if this is I know I put the picture in. I'll just hold on, I'll show you the picture. Okay, so they go through this thing, it's called diapedesis, where they actually they leave through holes in the, what happens, okay, so if this is the capillary, or this is the bone marrow, okay, so think about the bone marrow, or the blood vessel, okay, they could leave the sinusoid, okay, so they could leave the sinusoid easily, just like that, which would be like the spleen, or the bone marrow, okay, but then they just kind of migrate out, and they migrate out kind of like an amoeba, like a little bit slips out at a time. Okay, now they're going to be attracted to areas where the microorganisms are and where the other white blood cells are fighting infection, or areas where histamine is. Okay, and that process, they're attracted by chemicals, so they call that movement or attraction to those areas chemotaxis. Okay, now, leukocyte disorders. So first one I have on here is leukopenia. So it's below 5,000, and that should be per microliter. So this can be caused by radiation, maybe some pesticides, poison. Sometimes infectious disease can lower it. So if you don't have enough white blood cells, okay, that puts you at a greater risk for infection. Okay, now leukocytosis means you have high white blood cells. So a greater than 10,000 cells per microliter. So this could be caused by the fact that you have an infection. Okay, so you might start making up too many, make too many. It could be caused by allergies. It could be caused by a disease, something's wrong. Okay, what they'll do is they can do a differential white blood cell count, where they'll count all the different kinds of white blood cells that you have, and they know, okay, neutrophils go up when there's bacterial infection. So then they'll say, oh, she must have a bacterial infection. Okay, so a differential count is when they look at the different types of white and they try to figure out what's actually going on. Okay, now leukemia is cancer of the hemopoietic cells, and it's producing a lot of white blood cells, and maybe they're actually getting out of the bone marrow before they're ready. Okay, so they're immature white blood cells, and immature white blood cells, like baby white blood cells, are being released, and you can't kill it. They're not ready to do what they're supposed to do. Okay, so I have just examples on here. Myeloid leukemia is uncontrolled granulocytes. Lymphoid is uncontrolled lymphocytes or monocytes. There's also acute and chronic. Okay, so acute means it happens fast. The disease progresses fast and you can die really fast. Chronic can be undetected, and then you can live for years with the chronic. So if you know anyone that has leukemia or had leukemia, they'll say, okay, it's acute lymphoid leukemia or acute myeloid leukemia or chronic. So you hear them talking about like ALL or things like that. So those are how they categorize it and how they classify it. Okay, so what can happen if you're making too many white blood cells? They might not be mature enough and they're not ready to fight infection, so you might be susceptible to to anything. Anything could happen. Another thing that happens is because your body's so focused on making these white blood cells, it doesn't clot well. Okay, so, and people that have leukemia lots of times are very bruised or have nosebleeds because the ratio of reds to whites to platelets is messed up. So the normal cell percentages is disrupted. Okay, now, this slide is just supposed to show you, okay, so here's normal blood. So here are all the red blood cells. Okay, that's all the little bagel looking things. And then these are white. And this is healthy blood. Okay, this is someone that has leukemia. So these are all white blood cells that have been it's like way too many, okay, and they're not developed properly.